You may be wondering right now whether or not you have IBS. Or you might be absolutely sure that you do because you've had a diagnosis. But one thing is for sure, your tummy is not happy. Now, whether or not you've been diagnosed with IBS, if you experience stomach pain, cramping, bloating, wind, diarrhea, and/or constipation on a regular basis, often accompanied by anxiety or depression, this series of videos is for you. Now, you're probably feeling pretty overwhelmed at the moment. Here's my promise to you, though. By the time you reach the end of this series, you will understand exactly what's going on and why it's happening. And most important of all, what you can do about it. So, what is IBS? IBS is not a disease. Rather, it's a wide range of symptoms that occur together. So there are no tests for IBS. The history of a patient's symptoms helps a doctor to establish a diagnosis. Now, until recently, IBS was not fully understood and doctors didn't really know how best to treat it. But the latest scientific research and discoveries have actually shed new light on this distressing disorder, and now we know the underlying cause. And after listening to these videos and reading the book, you will be up to date with all the current knowledge in this area. You'll also have a practical plan that you can put into action in your everyday life, and it's one that has relieved discomfort experienced by thousands of people just like you. So for a long time, as well as putting up with the distress and embarrassment that their symptoms caused, IBS sufferers also had to deal with doctors who called them hypochondriacs and told them their problems were all in their head. Nice, right? Well, thankfully these days we're a little bit more enlightened, and since around 2010 it has been widely accepted that IBS is a real disorder. You're not making it up. IBS is typically diagnosed after a patient has experienced recurrent abdominal pain or discomfort for at least 3 days per month in the previous 3 months, combined with a change in the frequency of their bowel movements or a change in the appearance of their stools. IBS can occur at any age, but it often occurs for the first time during the teens or in early adulthood, and it's twice as common in women as in men. Studies have shown that people who have a first-degree relative with IBS are at increased risk. Now, if you have IBS, you are not alone. Simply put, IBS is the most common gastrointestinal disorder in the world. Researchers estimate that up to 15 to 20% of people in the West suffer from it. And IBS represents up to 10% of the workload of family doctors and 60% of gastroenterology practitioners. According to studies, IBS patients make more visits to their GP, undergo more diagnostic tests, are prescribed more medication, miss more work days, have lower productivity, hospitalized more frequently, and account for greater overall direct healthcare costs than patients without IBS. So the burden of illness for IBS is significant. Research suggests that the disorder can have such a severe impact on your health-related quality of life that it has actually been linked to an increase in suicidal behavior. So if you've been suffering from IBS for a while, you've probably been to your GP, you've maybe even been referred to a consultant at the hospital. And if you were really unlucky, these medical professionals may have suggested that you were imagining your symptoms and you were just making it up. Now, if you were lucky and they believed you, you may have been prescribed antibiotics, antispasmodics, laxatives, or antidepressants. These medications may have caused some troubling side effects, including nausea, insomnia, palpitations, decreased appetite, and they haven't really worked, have they? So you may have turned to dear old Auntie Google and done your own research. Maybe you've cut things out of your diet, like gluten or dairy, in an attempt to cope with your IBS. And maybe this helped a little bit, but I'm guessing that it's left you with such a restricted diet that eating isn't much fun anymore. And you're still in pain, right? Still feeling down, possibly even afraid to leave the house. Now finally, there is something that can help, and we call it the kefir solution. It is all natural, it won't hurt you, it involves no nasty chemicals, and its only side effects are pleasant ones. You may find that while following this natural health program, you feel calmer, less anxious, less depressed, and more energetic. You may even lose weight and keep it off. If you have eczema, acne, psoriasis, or rosacea, you will most likely find that that clears up too. Such skin conditions are a common side effect of tummy problems, and I will explain why shortly in this video series. In this series and the book that goes with it, I'm going to share with you some common sense and some uncommon science about what's causing your IBS, depression, and anxiety, and explain what you can do to feel better. The kefir solution has worked for thousands of our Chuckling Goat clients, and it can work for you too. You'll find all the details about how to apply the science in your own life in my book, The Kefir Solution, Natural Healing for IBS, Depression, and Anxiety. See you next time.